Hi there, and thank you for joining UnSCRIPted. I'm Angela Kashuba, Dean of the UNC Eshelman School of Pharmacy. We have an amazing community here at the school, all working towards a shared goal of solving the world's most pressing healthcare challenges. I'm excited for you to hear unscripted stories of faculty, staff, students, alums, and partners. Today, I have invited Dr. Benyam Muluneh to my office for a conversation. Benyam is an assistant professor in the Division of Pharmacotherapy and Experimental Therapeutics. Thank you so much, Benyam, for joining me today for a conversation.
Thank you for having me. I'm really excited to be here.
So we're going to go way back to the beginning. I want to know where you grew up, how you grew up, and what experiences shaped you wanting to go into the pharmacy profession.
Yeah, so, I was born in Ethiopia in East Africa, and I grew up there and came to the States when I was 10. And, when I was in Ethiopia, one of the memories that I have is my aunt being diagnosed with advanced colorectal cancer, and our family trying to do the best to try to get her treatment, but unfortunately not being able to do that and her succumbing to the disease. So that was something that really stuck with me when we moved here. And as I was, kind of discovering what I wanted to do, I knew that those experiences I've seen with lack of access to healthcare sort of drove and fueled some of my interest into thinking about healthcare, and eventually landed at pharmacy through some exposure from my uncle.
Talk about your uncle.
Yeah, so my uncle is a faculty member at Howard University, and just seeing the amount of knowledge and experience and community engaged work he was able to do to really close these gaps that existed in healthcare delivery for immigrant populations was really exciting. But as I was thinking about what I was going to pursue, he sat me down one day at the kitchen table and he was like, let me tell you about the profession of pharmacy. I know you've seen me talk about this before, but let me tell you about all of the different opportunities that exist with teaching, obviously, like that he did, but also with research and practice. I was immediately sold.
So tell me how you chose a clinical path to pharmacy. You were a clinician for many years across the street at UNC hospitals. So talk about that.
Kind of going back to the beginning of how I started the story of my aunt's experience with cancer, there was always an interest in oncology, pursuing hematology oncology, and wanting to find solutions to improve the delivery of care for patients with cancer. Eventually rose to the top through my immersion rotation experiences. So that's really what drew me to pursue a residency program here at UNC. So I stayed. I did undergrad pharmacy school, then I stayed to do residency, and really stayed on to work in our malignant hematology clinic. And so that's been really an exciting opportunity to not only really connect with patients and provide healthcare services, but also to begin to kind of have the foundation for my research program.
Yes. So let's talk about that and the transition from being a clinician to now being a researcher. You've been a faculty member here at the school for almost 5 years now, and you made that transition kind of intentionally, that you were interested in the research side. So talk about that transition and what it was that was driving you to make that career change.
Yeah, so I think for me, I'd say like year 3, year 4 of my career as a clinician, I started being more, I guess, I don't know if obsessed is the right word, but spent a lot of time thinking about why we keep seeing similar patterns of problems and gaps, and whether that be in medication adherence, toxicities, medication access, tolerability. But I realized that I really wanted to pursue research and spend more time doing that, and really designing interventions and studying kind of the implementation and evaluation of various health promotion programs within the oncology space.
Yeah. So moving from kind of individual patient-centered focus to now population
Yes.
focused, which I really like. I think that's a really wonderful transition. So now you have a National Cancer Institute Career Development Award. So congratulations
Thank you
on
so
that.
much. Thank you.
And talk about what you're doing with that award and how that is going to develop you as a researcher.
Yeah, so, I would have, I'll say, never applied or thought about applying if it wasn't for my Campbell mentoring team. So I do want to kind of recognize the Bill and Karen Campbell mentoring program for junior faculty. I think that's been truly transformative. So the work really is trying to understand. So I mentioned earlier in my practice, seeing patients not having access or not taking their medications as prescribed was truly shocking to me. And here's why. It's because I saw in a low income country, my aunt pass away from not having access to chemotherapy. And the fact that that could still be happening in the richest country in the world was really bewildering. And so I wanted to understand what are existing challenges for patients to be able to access and adhere to their chemotherapy regimens, and how do those barriers differ by setting. So what we're doing is we're starting out by interviewing patients, and here at UNC Academic Medical Center, Rex Oncology, so that's our urban community setting, and then McCreary, our rural cancer setting, to try to understand differences and barriers patients might face. And then for our second aim, we're going to be designing a comprehensive interdisciplinary medication support program for patients with cancer in those three settings. And within that, from a method standpoint, I'm interested in what are the core components that could be threaded throughout the intervention, but what are those tailorable pieces that need to be different in response to the needs of each, in those patient populations in those settings.
That's terrific. It is very interesting, the parallels of access to care and needs that we have in North Carolina compared to your experience in Ethiopia as well. So you are doing some work in Ethiopia. You've been doing that for a while, and you took a group of students with you to Ethiopia last year. So talk about your work that you're doing overseas.
So every year we take students and residents from the hospital side as well. And we're currently engaged in a variety of different projects. I'll talk about two of the ones that I'm really excited about. One is the implementation of a pediatric cancer registry across the country. And we worked with 5 hospitals to implement a national cancer registry for the pediatric cancer population. So for the first time, they'll actually have data behind what are the rates of cancer in children, how are they being treated, and what are the outcomes, and in order to be able to advocate for resources for the Ministries of Health, WHO, so on and so forth. And the second project is at initial stages, but we're hoping to launch a therapeutic drug monitoring program. Currently, there are a lot of narrow therapeutic index drugs like vancomycin, aminoglycosides, methotrexate, phenytoin that are given without levels, which do lead to harm. So we're hoping to kind of motivate the pharmacy practice there to kind of take charge, similarly to how clinical pharmacy movement started here. So that's been really, very exciting.
Wow. So there's some really significant global impact by using some of the skills and tools and knowledge and sharing that and collaborating. I love that.
Yeah, it's been really great. And I would say that, interestingly, the work that I've done in the global space has also fueled my passion for rural health here in North Carolina. I think that's been the interesting thing I've seen, and I don't think I would have intentionally written in the rural aspect into my grant if it wasn't for my, global health experience.
Yeah. Talk about the parallels between your experiences on the global stage and how those can be applied in rural North Carolina to improve health.
Yeah, I think there's quite a connection. I think sometimes there is a bit of tension in trying to understand like the rationale behind conducting global health work. I would say the first thing for me is cultural sensitivity and community engaged work is very much infused into the foundation of global health work. And the community engaged part is also involving patients into the work that we're doing.
Yeah.
I think there's sometimes, at least in my work here domestically, there's a thing of like developing out this program and then like
Plunking it.
But patients have not given enough input. Community engaged work is very much done in global health. So I think those skill sets I've sort of brought into my work here in rural health. I'd say the other ones are, low cost innovations and also kind of creative solutions, if you will. Not everything has to cost so much money. And that's, again, in the low resource setting, we have to do that.
Right.
So I think applying those to low resource settings here is something that I'm also really kind of interested in.
Yeah, no, I think that's terrific. We talk about our mission being to develop leaders and innovators. Innovation happens in these global settings, and to be able to expose our students to that and have them have that kind of an innovative mindset to bring back to the work that they're going to do in the U.S., I think is really critical, is really important.
Yeah.
It's a good learning lesson for them. Yeah. You're also involved in the Ethiopian community here locally.
Yes.
Can you talk about your work?
Yeah, so that's really something that I'm very passionate about. So there is a growing Ethiopian population here in the RDU. So for me, I'm interested in helping youth, be productive members of society, whether that be through, college prep programs, through connecting them to different internships, using my network. We have, programs to engage with college students, especially during their freshman and sophomore year, to make sure that their college transition is as smooth as possible. And then also career exploration. So we do events bringing in different members from the community to expose these students to different career options. I will say earlier in my mentorship, I was more like everyone has to do pharmacy. I've mellowed out since then now. So I do try to expose them to, broader career opportunities and then try and connect them with people so that they can be successful.
Yeah, that's terrific work. Thank you for spending time with me today. I really appreciate the conversation.
Of course, thanks for having me.
Yeah, my pleasure. And thank you for watching. We love sharing stories of those who make the UNC Eshelman School of Pharmacy excellent. We hope you will join us for the next episode of UnSCRIPted, conversations with the people who are advancing medicine for life.